NHS England was made responsible for commissioning specialised services under the Health and Social Care Act 2012. This was one of the more popular changes introduced by the controversial Act, as it was intended that by commissioning specialised services on a national basis, this would end the variation in standards and access to treatment experienced by patients living in different parts of the country, the so-called postcode lottery. There are currently 143 services defined as specialised. These range from radiotherapy and upper gastrointestinal services, which are widely provided, to paediatric heart surgery and gender identity services, which are available at only a handful of centres. It's fair to say the budget for specialised services has been a bit of a movable feast over the past year. At the beginning of 2013-14, NHS England estimated the cost of these services would be £11.9 billion. By the end of December 2013, month 9 of the financial year, the amount NHS England was planning to spend on specialised services was £12.7 billion. However, its forecast spend was even higher at £13.2 billion, equivalent to a 3.5% overspend. So where has this increase come from? First, the change in planned spend, which grew from £11.9 billion to £12.7 billion. Most of this can be accounted for by a transfer of £600 million worth of activity from clinical commissioning groups to the specialised commissioning budget at NHS England. This was because this activity had been wrongly categorised as non-specialised, and so the money to pay for it handed to CCGs, when in fact, as the year went on, it became apparent the activity was specialised. Why the confusion? Well, 2013-14 was the first year the commissioning of health services had been divided between specialised and non-specialised commissioners in this way, and data on what was poor. However, it is improving. A technical algorithm called the identification rules was developed to align activity between CCGs and NHS England based on the code given to the treatment a patient received. There is still work to do, and this is being refined all the time. So what about the overspend? Where's that come from? One of the reasons given by NHS England is that they have improved access to services in some areas where they were not previously available, ending the postcode lottery referred to above. They also say there has been growth in activity in some areas. NHS England did not provide further details, so it is difficult to say which areas or services saw growth and which services improved access. Anecdotally, there are reports of growth in spend on drugs for specialised services, including cutting-edge cancer drugs. However, the finance directors HSJ has spoken to suggest that there has been little actual extra activity or growth, and what NHS England has spent on services at their trusts is broadly in line with what they predicted at the start of the year. NHS England, the finance directors say, chose to disagree with their estimates of activity and imposed challenging saving targets, which means that overspend was entirely predictable in their eyes. There is speculation that CCGs have still ended up with too great a share of the NHS budget relative to the services they are responsible for commissioning. However, even if that is the case, NHS England has already set CCG budgets for the next 2 years to enable them to make longer-term plans, and it's unlikely they would make another raid on CCG finances. This year, 2014-15, the budget for specialised commissioning has grown further to £13.5 billion. Providers are still being asked to find £800 million of savings. The challenge for NHS England to stay within its specialised commissioning budget remains.